Hi, I'm Dr. Clark from Creekside Animal Hospital. I've been asked to do a few vlogs for our clients. Um, what I'm going to start with is my favorite subject, and that's allergies in dogs. Allergies are extremely common in dogs. In fact, there isn't a day in the year that goes by that we don't see and treat a dog for allergies in our clinic. And there are some times of the year, like August, September, October, when the allergy season is so heavy that it seems like that's all we do is treat allergic dogs during those months. Um, what does it take for your dog to be an allergic? Why is your dog allergic? Well, it's very simple. One or both of his parents had to have been allergic. That is a genetic predisposition that is passed on to the offspring. Now, once they have that genetic predisposition, it also requires repetitive exposures, not just one exposure, but repetitive exposures, which means it's usually not something new in the environment that your dog's reacting to, but something that's been there for a long time. Ragweed, for instance, the number one allergen in dogs. The first ragweed season your dog experiences when it's a puppy, no problems, because they don't usually react to the first season. But the second, third, and fourth, and so on, it tends to get worse and worse and worse, which is also slightly different from human allergics, because human allergics tend to get better as they get older, whereas dogs just tend to get worse as they get older. Now, what we'll see commonly as far as symptoms: itching, scratching, discomfort, face rubbing, foot licking are all classic symptoms of allergy in dogs. And what tends to happen is what I often refer to as a domino effect. First, the allergic problem causes itching in the skin. That itching causes the dog to scratch and bite and chew. The scratching, biting, chewing damages the skin. There goes another domino. That damaged skin becomes infected, and we get staph infections. Yet another domino. The skin is now terribly irritated. There are millions of skin glands that are there for a good reason to produce an oil which provides safety for the dog and protection for the dog, especially against water and other things outside that are damaging. But if they produce that to excess, which they do when the skin's irritated, now the dog's skin gets oily and stinky. And because of that, you bathe it because the dog stinks. But what you've essentially done is irritate the dog's skin even more. So we have domino after domino after domino after domino, which will come into when we talk about treatment, how we have to set those dominoes up one by one and not just use one pill to make it all go away. This has been a fairly decent overview of allergies. We've now just kind of touched on treatment, but the next vlog, that's what we're going to talk about, is how do we treat dogs with allergies. And speaking of treating, clients, when they want treatment for their dog, we talk about clients want the big C, which means cure, not cancer. The big C of cure. We can't cure this. It's incurable. But what we can provide is what I prefer to call little c, which is control. We can control this disease, but the minute you stop controlling, it will come back in spades. And this is what frustrates clients, because they think that once they've given the pills and the dog is much better, and then they stop giving the pills and the dog gets worse, now they're angry. it's not a reason to be angry. You just have to understand allergies. They don't go away unless what the dog is reacting to goes away. So as long as that pollen or that dust or that mold is in the air, the dog is not going to be comfortable without its medication. So next vlog, we're going to talk about treatment. Thank you.